Hi, my name is Rachel Kelly, and this week I'm going to teach you something about hemolytic uremic syndrome. So, hemolytic, hemolytic uremic syndrome, or HUS, is most commonly caused by a GI infection, so something like E. coli. And what happens is because of the infection, the body reacts to the toxins, and as a result, platelets and RBCs, red blood cells, die. So, these platelets and RBCs, instead of filtering through our kidney system, our G system, they block our kidneys' filters. Now, our kidneys are two bean-shaped organs just below our rib cage on our posterior side, each on one side of the spine, that are responsible for filtering roughly 120 to 150 quarts of blood per day, and they filter this blood into 1 to 2 quarts of urine. This is an average for adults, but it is based on the child's age for children. So the blocked filters in your kidneys put your child at risk for acute kidney injury, and AKI, because the urine is not filtering through. The filters are clogged with these destroyed, damaged red blood cells and platelets. So the HUS is the most common cause of an AKI in children, and especially under 5 years old. It can happen in adults and children over 5, but it is less common. So symptoms of HUS are vomit and diarrhea, lethargy, weakness, bruising. This is all due to the fact that your child is experiencing dehydration, anemia, and uremia as a result of this condition. Labs for this condition, you're going to see a thrombocytopenia, low platelet count, and also low RBCs, and you are going to see potentially a heightened BUN creatinine, so kidney panel. And you may also see evidence of decreased oxygenation. This is because red blood cells contain hemoglobin, which is an iron-rich protein that is responsible for carrying oxygen throughout your body. So if you're having low red blood cells, as a consequence, you could also experience a decrease in oxygenation. Excuse me. So triggering events, you could also be, in addition to E. coli, that is, which for E. coli specifically, if you're trying to diagnose HUS as a result of E. coli, you could also take a stool sample to test the stool for E. coli. But also triggering events, you could have pneumonia, you could have immunosuppressive disorders like medications like chemo. Even other medications like birth control can play a role in this, but working with the most common age group, that wouldn't be applicable. And also AIDS. Interventions for HUS. The primary intervention is going to be administering IV fluids. And in addition to that, if your child's experiencing severe anemia, they may also undergo a blood transfusion per your consent. And typically, this is a self-limiting condition, and it does resolve. The prognosis is very good. And the hospital stay can span from 3 days to 3 months, but typically it's around 2 weeks for recovery. So that's my overview of HUS. Thank you.